Hey, Dr. Bob here with Life Chiropractic, and in our office we offer two types of care. So the first type of care is what we call symptom-based care, and then the second type of care is what we refer to as wellness-based care. Now, symptom-based care is exactly what you think it would be. It's someone that comes into our office and they have a symptom or a set of symptoms that, they're looking to get some answers. Like for example, they're trying to find out, if they have headaches or back pain, sciatica, maybe they have a child that has recurring ear infections. Whatever the problem might be, they're trying to figure out, why is this problem here? What's causing it? Where is it coming from? But they basically need some answers. So in that case, what the process looks like is, we do a consultation, an examination, possibly some diagnostic testing, but our goal is to find the root cause of the problem, and that shows me, first off, if I can help, also shows me how much I can help, and then what the process would look like. How are we going to go about trying to eliminate this ailment? So with this one, we're trying to find a diagnosis and then provide recommendations, as opposed to what I would call wellness-based care, which is a little bit different. So like a wellness care-based patient is somebody that, if they do have pain, if they have symptoms, it's very low, on a scale from 1 to 10, if 10 is the worst pain you've ever felt. Somebody that's in wellness care is going to tell me that their pain is typically like a 2 or less. It's like a 0, a 1, or 2. It's not bad. Maybe they've had recurring symptoms in the past and they're trying to prevent them from coming back, or maybe the problem just started and they're trying to prevent it from getting worse. It might be someone that's been under chiropractic care in the past and maybe they've corrected their issue as much as they can, and they know that maybe they can't eliminate it completely, so they're just trying to maintain their progress and where they are. So it's a little bit different than symptom-based care, because this type of patient that comes into our office is typically, they know they're going to respond well to chiropractic care, so the process is a little less involved. We're going to focus more on their spine. A spinal exam will be performed, and then chiropractic adjustment is going to be the solution here. So I just wanted to show you the difference between these two types of care in this video, just because when you schedule an appointment online, you're certainly welcome to call our office and do so, but we also offer an online scheduling calendar that you can schedule your appointments yourself, and you'll see different categories, and this is how they're broken up. So you'll see a new patient exam on one side, and then you'll see just a wellness type of an adjustment on the other side. Some of the most, frequently asked questions that we hear, first off, somebody will look at our website and they'll see, for example, I'm going to schedule the new patient examination, and they'll see that it consists of the consult, the exam, diagnostic test and recommendations, and they'll say, well, nowhere in there does it say that I'm going to actually get a treatment on that particular visit. And if somebody's like a 10 out of 10 pain level, like if their back's really bothering them, I know that getting relief is like the number one priority. So they'll ask, well, will I get treated on that same visit? And my answer is that it always depends on the situation. But my goal is always to provide relief as soon as I possibly can. So if somebody is in pain like that, if it's possible that maybe I can't treat them on the spot, I can usually get them treated within the same day, if not, clearly within 24 hours. That's the longest anybody would ever go. But in a lot of cases, I can treat them on the spot. It just takes a little bit longer to put things together and provide a more accurate and safe treatment as well. And then the second type of question that I hear would be, do you accept insurance? What does the cost look like with these two types of care? When you come in and you have symptoms and you're under that symptom-based care, typically insurance will cover those visits. And this is all kind of broad too, because it really depends on the insurance and the company and policy and everything like that. But just generally speaking, the symptom-based care more often than not qualifies to use health insurance, where the wellness-based care does not. And the reasoning for that is, like I said, all insurances are different, but if someone's coming in and they don't really have a lot of pain and they don't meet certain criteria, then typically most insurances just won't cover wellness care, but they do cover symptom-based care. But what I would say is that if you are using your insurance for the symptom-based care, we verify benefits, we submit insurance on your behalf, and we let you know up front. Typically, we can give you a good estimate on what your benefits look like. If you're not using insurance and you're using the wellness care type of visit, You can see our services and rates online on our website, but those are just flat cash fees, and you don't have to worry about insurance and submitting it and getting a bill 6 months later. It's nothing like that. So hopefully this video helps provide a little bit more information on the types of care that we offer. We're accepting new patients, so feel free to call our office at 980-406-3862, or feel free to schedule online. You'll see at the top of the home screen there's a book online link. Just click on that and it's a live calendar so you can see what spots we have available. It's really easy to use and you can schedule that way. And I hope to see you soon.